You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And my first guest, I interviewed him 14 years ago, and he used to tell me that he's changing people's lives. And he said way back then, 14 years ago, that nobody should be wearing a loose-fitting denture, and they should be attached to something. And so today we have one of the most experienced guys in the business, Dr. Richard Seberg. Dr. Seberg, welcome to the program.
Thank you, Randy. It's nice to be here.
It's been a long time. So you've always done dental implants? I mean, this has been your focus for many years?
Yeah.
How many years?
Oh, wow. 42.
42 years?
40. I hate to say it, you know, but that's been how long it's been, and wow, has it changed.
My joke with you, I said that you've been around dental implants since they crawled out of the ocean, right?
Yeah.
As a one-celled whatever.
Yeah.
But what has changed? I mean, it's just easier now? The implants are smaller now, or it's more affordable? All those things?
Well, gee, I mean, start with the, as compared to the implants that we used in 40 years ago, there's no similarity to today's and the ones we used then. Materials have changed to a wonderfully biocompatible material called titanium. Everyone knows about titanium. We put it in the knees and the hips, and it's used all over the body. So dental implants are made out of titanium. Techniques have improved. My goodness. When I think about what we did back then versus now, I just shake my head and I say,
right?
How did that work? Yeah, but it's improved dramatically. And what we're able to do for people now in such a short time as compared to then, it's night and day.
You say their lives change.
Oh golly, yes. You see it every time you complete a case. It can be just one implant. It can be a whole mouthful of teeth. But it's a dramatic change in their...
Like what do you mean dramatic?
Well, you know, Randy, you have good teeth, right?
Thanks,
Yeah, good teeth, nice looking. They don't come out. Now just imagine that every time you laughed, you had to stick your tongue up there to hold that denture up, because you knew that if you laughed too hard, it was going to fall out.
Okay.
I remember one lady, that's what happened to her. She came into my office, new. I saw her, and she was new on my schedule. I went in and introduced myself, and I could see immediately, no teeth.
Yeah.
And I says, well, what can I do for you? She says, you've got to fix this. I said, well, what's wrong? She says, well, I came here directly. I was shopping with a friend, and we were out in the parking lot, and I laughed, and my denture fell out on the concrete and broke. She said, what am I going to do? And I had seen, your...
And she saw you on TV?
Yes, she saw me on TV, and so
She said, I have to go see Dr. Seberg.
That's it.
Did she ask about me at all on that? I'm joking. I'm joking. Okay, so she comes in.
Yep. I took a look at her and I said, well, here's your options. You can do another denture. She says, no. I said, well, you can do, put a couple implants in to hold the denture in so they won't fall out on you again. I said, well, or you can put 2 or 3, 4 implants in and still wear a denture. It has to snap on to these.
Yeah.
And I said, but the very best thing that you'll be the happiest with, I mean, it'll feel natural to you. You can eat anything that you want to eat. Is, use a few more implants than that and put permanent teeth in. She says, that's what I want.
A full set of teeth that don't come in and out.
Yeah. Yeah.
And you're big on that. People need to know the dentistry is, because I've interviewed a few dentists, they're divided. Some like the snap in, snap out. Some people like the permanent set of teeth. You like the permanent set, the fixed set.
I do.
I mean, it makes sense.
Only because the patients are the happiest. Look, I make the snap-on dentures for people. That's what they want. But at the end of the day, they still have to take it out, brush it, put it in a glass of water, at night.
Yeah. Unless they're married.
Yeah.
Because you said that people hide it from their partner.
Yeah. Many people, they say, you can't say that anything to my wife or to my spouse, I should say, because he or she doesn't know I wear a denture. And I want to say, oh, yes, they do.
Oh, really?
But, oh, yes, they do. But they are your spouse, so they don't want to hurt your feelings, and they let you go on with that charade. So, at the end of the day, if you do a snap-on, they still have a denture. Now, that's okay for some folks. But for someone else, they want to look like they did when they were 20. They want to be able to eat that apple.
Yeah.
They want to be able to bite into a cucumber. They want to be able to eat a steak. They want to go out with their friends and eat. And they can't. They can't. I mean...
Isn't that right?
Well, sure.
So these denture wearers are kind of living somewhat miserably.
Yeah, very miserably. I have to tell you a story. It's on myself.
All right.
Okay, this happened to me.
I knew those teeth looked too good to be true, right? It's good-looking teeth, by the way.
Well, thank you. Thank you. I designed it myself.
Okay.
But a few years ago, I was in an accident, and I lost some of my front teeth. And so actually, everything that people can see right now are implants and
Let me see. Smile a little bit. Yeah, that's a good-looking smile. Yeah.
So, but I had to go through the embarrassing part of wearing a denture.
Wow.
Now, this is when I really got in touch with what my patients are feeling, you know? They always say you should walk a mile in their shoes or something like that. Well, I did.
This is a very good story, by the way, because most dentists, I guess, never get to experience
most of them
wearing
don't,
a denture.
You know. So I had to wear a denture. It was a partial denture. I had a few of my own teeth left. And nearly all denture wearers, I've seen it in retirement homes. I'll go into a retirement home and meet people, and you meet them, and they always have their teeth in. They look good. I walked one time into the dining room to meet some people, and they introduced me. Says, "It's Dr. Seberg. He's a dentist." I looked like a bunch of rats scurrying to get. They're all reaching for their teeth and putting them in
because they were embarrassed around you.
Well, yeah, but they were there eating, and they took their teeth out to eat because they were hurt so bad. They were miserable, so they could take their teeth out and wrap them up in a napkin and eat. But when I came in, they wanted to look good. So what happened to me was, I was just like them. I'd go to eat, out they came. Because, Randy, they hurt. The food gets under them. The stickum stinks. It tastes awful. And so I just like them. I'd take them out and put them there, eat, put them back in.
People that are missing teeth, you and I have talked, like the Staples Center. I mean, you could fill that, you say.
Goodness.
Fill it 10 times with upper or lower denture people. One of your patients on your video, because I was preparing for this interview, and it's a great video, and we'll have to show it at one of our breaks, but she says that you told her she could not only eat a steak, she could fight a dog over that steak and pull.
She's a wonderful lady.
That's what she said.
She's a wonderful lady.
So they can eat whatever.
Oh, absolutely. Interesting thing about that lady is Maria Jo, she had just sold a restaurant. She was a restaurateur. And so she came to me, she says, I've got to get these fixed. And Maria Jo was quite heavy. And so we did some implants and rebuilt her mouth. And came out beautiful. And she's one of the ladies, I think it's on that's being interviewed on here. And guess what?
What?
She came in for a follow-up about 6 months later. I looked and I says, Maria Jo, are you losing weight? She says, yeah. She says, yeah, I can eat what I want to eat now. I don't have to eat pasta. I don't have to eat bread. I can eat a salad. And so she came in another 6 months later, so now that's a year. My God, how much weight she had lost. And it was all because she could now eat.
She could eat and chew.
Yeah.
You know, we've talked, you know, I like your line that in life there's two simple pleasures that everybody should be able to enjoy, which is to be able to laugh at a joke and to be able to eat. And you say there's so many people that can't do those two things.
Oh yeah. You can't, they can't eat. I mean, they'll try. And if you ask a denture wearer, well, how are your dentures? They're going to say, oh, they're fine. They're great. But they don't say that to me.
Yeah, to me, I know a couple. They never complain.
That's right. But why would they complain? Why would they complain to you and let you know that they're miserable? It's so uncomfortable.
One of your patients, I'm quoting a video. I saw your patient being interviewed, right, preparing for this interview today. And they said that if denture wearers knew how good it would be to have teeth again, that Dr. Seberg couldn't handle it.
I couldn't, and all the other guys that do implants couldn't either.
They'd be lined up?
Yeah, Randy.
Do you think there'd be rioting in the streets? A bunch of...
All of my patients, without exception, always say, gee, I don't know why I didn't do this sooner. You know, I was afraid of the pain, and there wasn't any pain.
Now, there's a little bit of pain, we should say, so we don't get in trouble on this show.
Okay.
There could be some discomfort, is that right? But
well, not during the procedure. There's no discomfort during the procedure. Most of my patients are asleep. Not all of them, but most of them have some sedation and are asleep. Afterwards, depending on the extent of the procedure, there might be a few days of some mild discomfort, but with the medications we have today, it's taken care of. So the fear factor, once they've had it done, they realize that wasn't valid.
What is your oldest patient that came in, they had no teeth, maybe they needed extractions, and you gave them a fixed set of teeth?
Yeah.
What's your...
93 years old.
Really, 93?
Yeah. Yeah. And, you know, I always get asked this question, why would a 93-year-old want to do that?
That is a good question.
Yeah, why would they do that? Why would you do that to a 93-year-old? Well, it's very simple. That 93-year-old patient wanted to continue to live life. This happened to be a male. He wanted to continue to live life like he had been living it, and he could not with the dentures. It broke up his, his social contacts. He couldn't eat, couldn't go out with friends. He wanted to be whole again.
Okay. There's like probably a million people, more than that, in the LA County, Orange County, because you draw from all these areas, San Bernardino County. True. Their teeth are bad and they're headed to dentures, right? Yes. And they have really bad gums. Yes, you say that that's not a problem. Your gums are not the problem. You could still get this done. Like a beautiful brand new set of teeth.
Right.
Is that right?
That's absolutely the truth. You know, you have the bad gums because the teeth are bad. When the bad teeth are gone, the gums heal.
It's an infection, bacterial infection.
Yes,
okay.
Yeah, sure is. And no, it doesn't look very good. It gives them bad breath, painful. But if you remove the teeth, that infection goes away. And incidentally, today, the biggest procedure, the newest, is it's called, there's many different names for it. And your viewers may have heard of it, all on 4 or 5.
That's like a full arch of teeth on 4 implants.
Yeah.
Okay.
Our technology's come that far. We used to use 10 implants for a full arch of teeth. Now we can use 4 or 5. Or teeth in a day. Bottom line, what happens is they walk in without any teeth or some bad teeth. They wake up, the bad teeth that they had, some are gone, and they wake up with permanent teeth anchored in, beautiful smile, and they can't really, most of the times, can't believe it happened. And they walk out of there smiling, able to eat, and they're very, very happy. It's the nicest thing we do for patients today.
Now, Medicare, Medicaid, and even if you have the best insurance in the world, does not cover the whole, I mean, maximum payout in insurance here in California is like $1,500, $2,000 for the whole year.
True.
So it does not cover the whole procedure.
No, it doesn't.
But you have financing if somebody has credit.
Yes, we do.
You'll work with them.
Yes, indeed.
People figure out ways to pay for this. That's what you told me.
It's amazing. Yeah. They come up with all sorts of ways. I don't always know how they did it because that's their business. It's private. Okay. But I have to tell you.
All right.
I used to do lectures to the public.
Yeah.
To get the word around.
About dental implants.
Yes.
Okay.
And so I remember one of these, and Randy, it was really something. I was aware that there was a lady sitting in the very front row. She was in a pair of old jeans and a t-shirt.
Yeah.
Really not a very nice t-shirt. But her eyes were just boring into mine watching me. And so I was finished, and a couple weeks later, she comes into my office. And she's same lady, same jeans, frumpy t-shirt. Says, I'm wearing dentures and I want to get some implants. Well, I immediately assumed that she didn't.
Like prejudging her a little bit.
Absolutely.
It's honest of you to
say. And we all do that.
Okay.
Try not to, but we all do. And so I presented her with a treatment plan, another upper denture, and then a snap-on lower denture with 4 implants.
Yeah.
And she said, no, that's not what I want. I want teeth that don't come out. I presented her with another option of permanent teeth that don't come out. She says, that's what I want. So the first procedure was I was on the lower. And so we got the lower done. And she says, well, when do we start on the upper? If anyone had seen me, I could have fallen out of my chair. I had no idea.
Well, that's a lesson for you to learn then, obviously.
Oh yeah, I learned it.
Not prejudging.
So I did
Interesting.
Full upper and lower, permanent teeth. But we started this conversation about how people pay for it. Mm-hmm. It's a funny story. So she never told me this. She told my assistant. And what had happened was her husband had died recently. And as it turned out, he was a miser. And she didn't know how wealthy they were.
Yeah.
Till he was gone. She found out they had multi-million dollars. She was so angry with him. She came in and got the very best she could get for her teeth. Then she had a facelift, and she bought a new home for all 3 of her kids.
That's a great story.
I thought, you never know where it's coming from.
We're going to take a quick break. We come back, more about the process, the dental implant process.
Okay. Sure.
As you say, no more dentures. Right? You're going to wipe them out one of these days. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I'm deathly afraid of the dentist, and when I came to Dr. Seberg, I was very concerned not only about being here, but about the pain associated with it. He offers the option of an anesthesiologist actually coming in, and there was no pain. After some of the major procedures, I took some medication for a few days, but by and large, he alleviated all my concern, and I was relatively pain-free most of the time.
The biggest thing for me was it felt good. I felt like it was my own teeth. I couldn't believe it. I felt that it was just fantastic. And of course, the looks, I was never so happy in all my life because I had suffered for many years with a mess.
I walked out of this office and he said, go enjoy yourself and eat anything you want. I said, anything? And he says, any. I said, I can bite an apple. He says, you can chew on a steak and you can fight a dog for the steak. That's how strong they are. And I have a dog, but I wasn't about to try.
The procedures he did on me were a success. I feel much better now. I believe I look better. I'm a lot more confident in my appearance, which in my profession is quite important. I think if I had to summarize my feelings about Dr. Seberg in just a very few words, I would use compassion.
I didn't know that dental implants could feel like they're mine. And I defy anybody to tell me they're not mine. That they are.
If they knew the improvement that getting these implants would make on their life, there wouldn't be enough hours in the day for Dr. Seberg to see them all. It's that good.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, No more dentures, according to Dr. Seberg. And you've done like thousands of implants over the years.
Oh, gosh.
Is that right?
It's up around 10,000.
You must
don't
be
count them anymore.
exhausted. You must be tired after all these implants.
I enjoy it very
For
much.
people just tuning in, I met you 14 years ago, and we've kind of lost, but you were doing implants then, you're doing implants today. I have never asked this question on my show, because I always say I want it to be real, I don't want to endorse the doctors, but you're a guy with some of the most experience in the country. So I'm going to ask you, this is the first time 16 years, why you? Why, with so many other doctors doing dental implants, why would they go to Dr. Seberg?
Results, Randy. They want to have the best chance to have it done the right time, the first time, and get the results that they want. They want the pretty smile. They want to be able to eat what they want to be able to eat. And cost, I do it both ends. I do both the surgery and the prosthetics, putting the teeth on there. Well, not only is that far more convenient for the patients because they're not going back and forth, back and forth, back and forth. They're able to, because I'm doing the whole thing, they're able to get it done faster and for less. I'm usually less
than the other
costly
guys.
than the teams where they.
Now, people drive an hour to you, so it's worth driving that hour.
Sure.
To get this done, right?
Well,
I'm not trying to side with you, by the way, but you are one of the guys that's done more than anybody.
I've done a lot of them, Randy. I have, and I've had wonderful success. And my credentials speak for that. I'm a certified or qualified member of the American Board of Oral Implantology.
Okay.
Number 252. I think that's how many there were when I got mine. I think they're up around 700 or 800 now.
Now, this isn't just this, and we're talking about people without teeth or people that their teeth are so bad they're headed to dentures. This is not just for poor people. Like you were saying, you're at that fancy country club, I should mention, right? In Newport, and you said one of your buddies.
Oh, gosh, yes.
You took care of golfing.
A couple of my buddies, yeah. Ranged from one implant and to one of them, he had a set of upper teeth that he was losing. We placed took the teeth out, placed the implants, and put the permanent teeth on in one day.
Did his golf game improve after you gave him his teeth?
Well, but he feels so much better, and he can eat what he wants to eat now. He was losing his teeth. It was difficult for him to chew. He knew where he was going, and he's an intelligent guy. He wasn't fooled by where he was, and it made him feel better, made him feel whole, got a nice smile.
When they look at the mirror the first time, it's a big deal to them, seeing their new smile. Do you ever see tears?
I have, and that's the best time, when they finally get it. I've gotten an awful lot of hugs.
Do you ever get choked up? Like after all these years, do you ever get emotional when they're looking and they're just so appreciative?
I wouldn't say I get demonstrative, but I get a.
Well, I don't think you break down crying,
No,
but
I get a feeling here.
Nice.
Life isn't all about money and success. It's the best part about it is when you do something for someone else to make their life better. That is the best part of life. It's when you do that for someone.
Good. Do you think you're at the top of your game after all these years doing dental implants? You tell me.
Absolutely. I sit down when I do the surgery, so I can do that I do it all day long.
So if somebody's complex and bone grafting and all of these other problems, can you pretty much handle most problems?
Yeah. I hear oftentimes patients will come and say, "Doctor, I wanted to talk to you. I've already been to a couple of other places and they said I don't have enough bone." But I thought, well, I'll check. And so I take a look and I tell them, well, you don't have a lot of bone. You have lost a lot over the years, but I can fix them.
You can do it.
Yeah.
A permanent set of teeth? That
Yes,
means
absolutely.
not the snap in, snap out. Even if you've been wearing dentures 20 years though, Dr. Seberg?
Yeah.
But isn't it true you don't have enough bone for the fixed set of teeth? after that many years in a denture.
No, that's not
That's
true.
not true.
That's not true.
I hear
There
that.
are so many novel ways of approaching it now. 20, 30 years ago, if you didn't have enough bone, you didn't have enough bone, and that was it. Game was over. Today, pretty much, Randy, if a person can they're healthy enough to get themselves to my office and sit down and let me do an exam, I'm going to say that 95% of them or better of the time, I can get them a set of fixed teeth.
Is that right?
Yep.
So no more dentures. No reason to be wearing a denture.
No, there isn't. I mean, it's, we have 30 million, in excess of 30 million people in the United States wearing dentures.
Is that right?
Yeah. We've got a backlog of work here.
Is that the future?
Well, of course.
where in the traditional dentures, the way we know them now, where they float on top with adhesive, that there will be no such thing as that someday?
Oh, I would hope there would be, but let's be realistic. There'll still be people wearing dentures. They don't know about them, or
Okay.
for whatever reason. But it'd be great if they all were put together.
So as a recap, and we're running out of time. Okay, so I guess with dental implants, especially with people either headed to dentures, you're saying they're gums, you could work with people with bad gums.
Yeah, absolutely.
You do extractions and give them teeth that same day?
Absolutely.
Really? They walk out with teeth?
Absolutely. I mean, that's almost the standard of care today.
And they look good.
Well, look at mine. You
They
already
look good.
commented
Let me
on
see
that.
those smile. They do look good.
Yeah.
But you could bite like a carrot with the front teeth.
Well, of course.
What about chewy things like a pizza or popcorn?
Since I happen to have dental implants, I can tell you I am totally unaware of them. I have no idea they're there. I never even think about it. I mean, I'm a dentist, so I know where they are. But most of your patients that have had them any length of time at all, where are your implants? Gee, I'm not sure where. You just aren't aware of it. You don't feel it.
Okay, so get this done. Two groups. They're headed to dentures. They don't want dentures, or they already have dentures. Get in, do something about it. Right?
Absolutely.
That's a summary. Free consultation?
Absolutely.
What about x-rays?
Well, that's included.
I want to thank you for coming on the show. I've known you for about 15 years. We're not buddies or friends, and I'm not endorsing you today, but you are one of the guys that has the most experience. So congratulations. And I know you're helping people because I've been a few of your patients years ago. So thanks again.
Thank you, Randy. Thank you very much.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez.